side of the shark, there's that horizontal line separating the ventral muscles, which we call what?
Hypobranchial.
Hypaxial, from the more dorsal muscles, which we call appaxial. Okay. And actually that line on here is actually this line right here running along.
Oh.
Okay. Just to point out, it's actually more dorsal than you might think.
Yeah.
Okay. So that's that line. And just remember that the myomeres always angle forward at that point. That's helpful. And that the lateral line canal runs along that boundary as well. There's a bundle of muscles that runs along the side here, called a longitudinal bundle, that looks darker and a little redder than the remainder of the muscles. And this is the red muscle, and that's the muscle that's used for active swimming. It's well oxygenated, red fibers, whereas the white muscle, which is most of the marine muscle, is used for quick bursts of swimming, and it's fast glycolytic or anaerobic metabolizing muscle. Okay. And then in the head region, over the gills, the epaxial muscle runs forward, and that would be called epibranchial. And the hypaxial muscle runs forward as well, and that was mostly where people spent their time today. That would be called what? Running forward in the hypobranchial. Okay. So, I'm just trying to decide which of these guys to start
Read
with.
that one first. It's probably easier to see the outside ones, yeah.
Yeah, I think it is actually. So, if you look at the ventral side of the pharyngeal region here, you can see the hypaxial muscles running forward, and you can feel right in here the bar of cartilage. That's the ventral part of the pectoral girdle. What's that called? Coracoid bar. That was on the quiz. So that's the coracoid bar. And in front of the coracoid bar, we can see the beginning of the hypobranchial muscles. And you see these two triangular muscles here and here. And those would be the Come on, you guys just did it.
Coracohyoid?
Not high, starts with an A.
I have a question, not an answer.
Okay.
Why do they all have the prefix coraco for the muscles?
Because they're starting from the coracoid bar.
Oh, okay.
So they're named for their attachments. No, that's a good question. So coracoarcules are these two muscles. You're going from the coracoid bar to the branchial arches. It's coracoarcuole. Okay. More anteriorly, the hypobranchial muscles are covered by this sheet of musculature, which is part of the branchiomeric muscles. And this is the intermandibularis and interhyoideus, which are pretty difficult to separate from each other, but they form this sheet that runs across the floor of the throat. And if you peel that back, like this, you can see deep to it, and maybe I'll unpin this for the moment so we can kind of lay it back down, a muscle, get my hand out of the way, running down the midline that's been cut here and here, and that's running all the way forward to the mandible from the coracoid, so we call that the mandibular or mandibularis, depending on if you want to be Latin about it. And then a pair of muscles on either side that are running from the coracoid to the hyoid arch, to the serratohyals, and those would be the coracohyoids. Okay. And just under the front end of the the coracomandibular, between it and the coracohyoids, is this mass of tissue that usually looks just kind of like grayish slime, and that would be the thyroid gland. And so if you see something semi-discrete in there with a pin in it, that's the thyroid gland. And sometimes they're a little more discrete than others. Sometimes it's really diffuse and hard to identify as anything in particular, but that's where it sits. Okay. So that's about as far as anyone got, although there were some things that were kind of people were going by. So, and the appendicular muscles, do we have like 1 minute? I can't quite see. Are we out of time?
49.
Okay, I'll just show you really quick. The dorsal and ventral appendicular muscles. Oops, the ventral was on the ventral. There we go. On this side, there's the ventral. appendicular muscle on the pectoral fin, and then these guys get it on the pelvic fin here, ventral and dorsal. What I wanted to say is, I know nobody got done today, and that's kind of expected.